This presentation is going to pertain to altered cast techniques. We will discuss when this technique would be indicated, what the advantages are, and how to do it. There are different reasons why an altered cast impression may be warranted. One of the reasons might be if a final impression was not very precise in the posterior area or not properly border molded. We could correct the cast using that technique. Another reason might be that we did not border mold during the final impression. In order to avoid distorting the impression in the region of hard tissue and avoiding having problems and distortion in rest areas, it might be a good idea in some situations not to border mold too vigorously. And this is going to be our chance to border mold later on. The other good reason for doing that, and perhaps the best reason why we would want to do an altered cast impression, is to solicit the ridges a little bit more. For instance, if a patient had a ridge that is very fibrous and very compressible, very mobile, if we were to take an impression in a static manner, we could have a very tall ridge which will collapse when we put any pressure on it and therefore will not support the bases very well. Now in opposition, if we were to use a material that is a little stiffer to take the impression of those mobile ridges, we would put that same compression on the ridges as we will later on with the acrylic, and therefore the acrylic will be better supported. So this is a way to take an impression that is a little bit more functional. We don't always do an altered cast impression. In situations where the ridge is not very compressible, in situations where we don't have any tooth mobility, that everything is perfect, we may not need an altered cast impression. Altered cast impressions are very useful in Kennedy class 1 and 2s, but not so much in 3s and 4. However, if in a Kennedy class 4 or a large Kennedy class 3 patient, we had very fibrous and mobile tissues, the technique could still be useful. Altered cast impressions are very rarely used in the maxilla. The metal framework, the major connector, is already providing support from the palate. The ridges are not going to support the partial denture as much, and therefore the need for an altered cast impression is not as high as in the mandible. The other problem we may have if we were to take an altered cast impression in the maxilla is that we may actually get some material going under the major connector, and as a result the partial denture will not seat fully, and therefore it's often better to avoid this technique in the maxilla. In order to employ the technique, we need first to do all the steps required to get the metal framework. We need a final impression. That final impression needs to be precise enough to be able to fabricate the metal framework itself. It doesn't need to be very precise around that framework, more posterior, lingual, or buccal to the edentulous areas of the metal framework. However, everything else needs to be precise. The framework will be fabricated on the master cast. Once we get that framework, we would try it in the mouth, make sure everything is good, do any adjustments as required. Once this is done, a spacer will be placed between the metal framework and the cast for the impression. And a tray will be fabricated around the edentulous area using some cold cure acrylic. The peripheries will be trimmed exactly the same way as we would for any other custom tray. And this will be used to take the impression in the mouth. Once the tray is attached to the metal framework, we need to try everything in the mouth and make sure that it will seat fully without any interferences. We need to ensure that the framework can seat fully, that the rest will completely seat, that the plating will be in close proximation with the teeth as seen on the photo on the lower right. If the denture is not seating fully, the tray should be removed and the process should be redone. Before redoing a new tray, we would want to ensure that the framework does seat well without the tray in position. Before trying the framework with the tray in the patient's mouth, we need to disinfect it. With the disinfecting agent Optim that we use at Dalhousie, we need to soak the partial denture with the framework in the liquid for 1 full minute and then rinse it. We want to ensure that adequate seating of the framework is present. And then we check the peripheries. We want to make sure that we have about 2 to 3 millimeters of space between the tray and the bottom of the vestibule. This is to ensure we have good space to be able to border mold the tray. Remember that the compound material that we're using to border molding is only good in a thick layer. If it's too thin, the material will push the tissues away. And therefore we need to ensure we have that 2 to 3 millimeters to ensure we can make an adequate, accurate border molding. There are different materials that could be used to take the impression with the altered cast technique. A classic method used is to use Correcta wax, the orange soft wax. This wax is going to stay soft at mouth temperature. With the use of a water bath, we could molten the wax and then paint it with a brush directly on the tray. Seating that tray in the mouth will actually take the impression using that wax, and we could easily add wax as required using that brush and the liquid wax. The technique is very, very accurate with wax, but a little bit more technique sensitive than if we were to use other type of materials. The material that we're using at Dalhousie is polyvinyl siloxane. It's much simpler and faster to take the impression. We have different options for viscosity. We could use a light body viscosity. However, remember that if your goal is to solicit the ridge, this material might not be stiff enough to do so. And using a material a little bit more viscous, such as monophase medium body material, may be a better option than using light body material. Other impression materials could be used. For instance, polyether could be another option for those impressions, but it is not used at Dalhousie. Before taking the impression with the impression material, we need to ensure we have a good border. And therefore, we want to border mold with compound before taking that impression. Compound is ideal to do so, as the material will give you some time before setting. Well, you can move the cheeks and the tongue to border mold that region. It is easy to correct by adding or removing material, whereas border molding with a polymerizing material will not offer that advantage. Once the border molding is completed, we could remove the wax spacer, coat the tray with adhesive, and then we are ready to take the final impression for the altered cast technique. we will load the tray with the impression material of choice. It is important to be careful not to put any of the impression material on the major connector or under the rests. Otherwise, we could lift the framework of the teeth and the impression will not be as precise. If we were to use it to fabricate the denture, we will not be able to seat the framework fully. While seating the framework to take the impression, it is very important to avoid placing any pressure on the edentulous section of the ridge. We want to put pressure on the rest seats only. It is important to try to stabilize the framework and seat it fully as well as we could. And the best way to do that would be to put pressure on the direct and indirect rest seats. After the material has set, we could remove the impression and inspect it for voids, burn through, or other problems. We want to ensure there's no flash of material under the framework. If there was flash, and if the framework was not seating fully, a new impression would have to be taken. On the lower right here, you can see an impression taken with correcta wax, as we were discussing earlier. Once the impression is going to be given back to the laboratory technician, they will cut the sections where the new impressions was taken, and they will place the framework with the impression back on that cast. The section may be boxed or not, and the lab technician will report that section using another stone. This is an example of an impression that was just poured. And this is the bottom part of the slide. You can see what the altered cast impression cast does look like after it was cleaned up. If tissue stoppers were designed in the framework for the partial denture, it is important to notice that after a new altered cast impression has been poured, those tissue stoppers likely don't contact the cast anymore. And therefore, the lab technician would usually add a little bit of acrylic to ensure a good positive contact before continuing with the next stages. This is so that once the partial denture will be processed in acrylic, the new addition of acrylic with the pressure will not dislodge the partial denture. On the slide, you can see a list of the most common problems that could be encountered when using the altered cast impression technique. The first problem that will arise quite often is when the the framework is not fully seated. It is very important, as discussed earlier, to ensure that all the rest seats are fully seated in their space before taking the impression. The second problem is when impression material went underneath the framework. If impression material was going underneath that framework and blocking it from seating fully, this problem will perdure when the acrylic is fabricated. And therefore the partial denture will not seat fully when the patient would use it later on. So it is very important to ensure no extra material when underneath the framework. When the lab technicians are pouring the new impression, it is quite technique sensitive, and carelessly pouring the stone may cause some problems. The stone could go over the other teeth, that are kept on the main cast, for instance. So this is a step that needs to be taken quite seriously. Thank you very much for watching this presentation. Hopefully it answered most of your questions regarding altered cast impressions.